Hello, I'm Dr Sarah Jarvis, a practicing NHS GP, and I'm here to explain to you, a nurse or a carer, how to administer a coronavirus swab test to one of your residents. Don't worry, you don't need to be a medical expert to administer this test. But before you start, it's important to watch this video closely and read the instructions that come with the kit thoroughly. Throughout the process, take your time and be precise. You'll also need a colleague to help you along the way. Do make sure that they've watched the video as well. Let's start with some of the steps you need to take before you perform the test. The completed test needs to be sent to the lab quickly, so before you do it, make sure you've confirmed a collection time with your courier. Before you touch anything, wash your hands thoroughly with soap and warm water for 20 seconds. As you perform the test, both you and your colleague should be wearing the necessary personal protective equipment. Apron, mask, visor, then gloves. If you're testing more than one resident, it's crucial that you wear a different apron and gloves for each and every resident you test, disposing of the personal protection equipment safely in between. You can refer to latest Public Health England guidelines on sessional masking. In the space where you're performing the test, you'll need a clean and dry surface. This is where you'll unpack and set down your kit. You'll need to check that your kit contains all the necessary items. You should have a swab inside a sealed wrapper, one small sample collection vial that should contain a small amount of liquid, one transportation tube, one patho-seal bag, one large envelope, an instruction booklet, one sheet containing labels with barcodes, as well as a unique reference number. With your kit unpacked onto the clean surface, you need to apply the barcodes provided with the kit. The first barcode needs to be placed onto the plastic vial. If it already has a label, just place your barcode label over it. The second barcode label needs to be firmly stuck on the patho-seal bag. Lastly, place the third barcode label on the test record or in the resident's care plan. Your colleague needs to fill out the test record with the resident's details so you can avoid touching anything. They should take a recording of the time you start each test and log this onto the test kit website later. You're now set up and ready to perform the test. So let's get started. The person you're testing might be nervous, scared, or unsure. Take a moment to talk to them gently. Walk them through the steps and ask them if they have any questions. Staying calm and confident in yourself will be reassuring for them and will make them feel more comfortable. Whilst you perform the test, your colleague can sit with them and comfort them through the process. If at any point the resident becomes distressed, follow your local guidelines and abandon the test. As always, do follow your local guidance about consent, including what to do if someone doesn't have capacity. Check if they've had any recent nasal surgery, abnormalities of the nasal passages, or have cuts or any other injury that would make swabbing of the nose difficult. Ask the person to gently blow their nose and cough into a tissue. Immediately dispose of the tissue in a bin. Look into the person's mouth to locate their tonsils. This is the area that you'll be swabbing. If the person's tonsils have been removed, swab in the area they would have been. Open the swab package and carefully take out the swab. It's really important you take care not to touch the tip of the swab to avoid contamination. If you do touch the tip during this process on anything you're not meant to, please start again with a new swab. This swab will be used on both the person's throat and nose. Ask the person to open their mouth wide so you can gently rub the swab over both tonsils as well as the back of the throat for 10 seconds. Avoid touching the tongue, teeth, or gums. Carefully remove the swab from their mouth without touching anything. Next, you're going to swab the nostril. Again, checking that you have their consent. Gently place the same end of the same swab, about 1 inch, that's 2.5 centimetres, into the nostril. Don't insert the swab any deeper if you feel strong resistance or if the person alerts you to pain. Again, do explain in advance that it may cause them a little discomfort, but it shouldn't be painful. Rotate the swab for 10 to 15 seconds and then slowly remove it. Carefully place the swab into the plastic vial with the fabric tip facing down and snap off the other end of the swab at the break point so that it fits in the vial. Place the lid back on the vial, making sure it's securely fastened shut. That's all there is to it. The swabbing's complete, and now you need to get the package ready for the courier to collect. Take the labelled plastic vial that contains the swab and place it into the transportation tube. Place the provided lid onto the tube securely. Next, place the transportation tube into the labelled patho-seal bag. Secure the bag shut by ensuring the adhesive strips make a tight seal. Place the sealed patho-seal bag into the large envelope from your kit. Seal it shut and wipe down the exterior of the bag. You can remove and safely dispose of your personal protective equipment. Remember, even if you're doing another test, you need to wear a new set of personal protective equipment. When the courier arrives, give them the fully sealed collection envelope, remembering to stay at least 2 meters apart. Don't forget to register the test online as directed in the instructions. If you don't do this, you won't receive the result. You've now successfully completed the Care Home Resident Coronavirus Testing Kit, and you'll receive the results by email within 72 hours. Upon receiving the results, follow the local Public Health England guidelines on informing the person and, of course, providing them with support. Thank you for completing the training. We recommend you watch this video again until you're completely competent with all the instructions. By doing this, you're helping to keep your residents and your community safe. We're going to beat this virus together. From everyone, thank you for everything.